Thank you for being here this morning for this very important announcement. And I am honored to be joined today by Governor Whitmer and also by Michigan's Chief Medical Officer and Chief Deputy for Health for the Michigan Department of Health and Human Services, Dr. Joneigh Khaldun. Thank you for being here. So Michigan's opioid crisis and the devastation that it has wrought on families and communities in our state demanded our attention when the governor and I took office nearly a year ago now. And that's why we went to work immediately to tackle the opioid epidemic on a variety of fronts. And I am delighted to have Governor Whitmer here today joining us to talk about this important issue. Governor?
Well, thank you. I am pleased to be here with all of you. I am proud to be standing here with people who have dedicated their first year on the job to ending the opioid crisis. You know, we've been able to get a lot of things done together. This is not my first press conference with Dr. Khaldun on opioids, and I'm sure it won't be the last. And we hit the ground running to combat the opioid epidemic this year. In August, I signed an executive order creating the Michigan Opioids Task Force of leaders across state government to bring every resource we can to end the opioid epidemic. And we've seen some real, meaningful investments to accomplish that goal. Earlier this year, we announced a $10 million partnership with Bloomberg Philanthropies. We announced a $5 million grant from the Michigan Opioid Partnership, a public-private collaborative between the state of Michigan and key nonprofit funders. The mission of these investments is to decrease Michigan opioid overdoses and deaths through prevention and treatment, harm reduction, and sustained recovery. And just last month, I set a goal for the state of Michigan to reduce the number of opioid deaths by 50% in 5 years. It's going to take a lot of work, but I know this team can get us there. This is a crisis. It hurts families from rural parts of Michigan to big cities. In 2017, drug overdoses killed nearly 2,700 people in Michigan, with 2,053 of those deaths attributed to opioids, according to the latest MDHHS stats. And according to the Centers for Disease Control report, overall drug overdose deaths in Michigan exceeded traffic and gun deaths combined in 2017. So this is not going away unless we make real, meaningful steps to protect our families and give those who are struggling with opioid use disorder the resources that they need to recover. We cannot beat a crisis of this magnitude at one organization or one healthcare provider or one government agency. It takes a coordinated effort to prevent further suffering from opioid use, to be able to treat successfully those who want help, and to reduce harm to those who are already suffering. We're all here today because we're prepared to use every tool in our toolboxes to reach that goal. I want to applaud Dana Nessel, our Attorney General, for her leadership and for taking swift action today. The work that the Attorney General's office is doing will help us prevent more opioid deaths in the future and will be crucial to us reaching our goal of 50% fewer deaths in the next 5 years. There's more work to do, work to ensure everyone has access to treatment and pathways to recovery, work to help families of those struggling with opioid use disorder. And there's more work to do, but this is a crucial step in the right direction. Where we can act, we will do so, and we will do so swiftly and surely and in a coordinated fashion. But like I said before, it's not state government alone that can solve this. It's collaboration with the experts in the field. And in the coming months, the Opioid Task Force will host regional town halls across the state to hear directly from individuals and in communities so that we can best partner and support one another's efforts. So now I want to introduce our Chief Medical Officer of the state of Michigan, Dr. Joneigh Khaldun, who has dedicated her career to ending this epidemic. Dr. Khaldun.
So thank you, Attorney General Nessel and Governor Whitmer. Your leadership is really just so critical to addressing this crisis in the state. The opioid epidemic is one of the most pressing public health challenges that this state is facing. And unfortunately, Michigan is in the top 15 states across the country when it comes to the rate of opioid overdose deaths. As the governor mentioned, in 2018, over 2,000 Michiganders died of an opioid overdose. That's a rate of over 5 people every single day. The number of people in the state who die every year from an opioid overdose has increased by 11-fold in the past 2 decades. And again, drug overdoses now kill more people every year than car crashes and are the leading cause of injury-related deaths in the state. When we look at the data, there is no question that this epidemic was ignited by the increase in prescriptions and availability of extremely addictive opioid pain medications. It's also had a significant economic impact on our state's public health system. Treating people in emergency departments, taking care of babies who are born addicted to opioids, and making sure have access to important treatment is incredibly important, but also costly. In fact, last year alone, the aggregate cost to our state to treat opioid overdose and dependence totaled over $110 million. That's nearly triple the cost in 2009. We cannot overstate the significant impact of this epidemic. We've seen families and communities across the state who have been devastated, and a host of reverberating consequences, including the criminal justice system and child welfare. As the governor mentioned, this really is going to take an all-hands-on-deck approach to overcome, and that's why I'm thrilled that we are tackling this work across multiple state agencies and with community members through the work of the Opioids Task Force that Governor Whitmer announced earlier this year and that I am honored to chair. Together, we are fighting this complex epidemic from multiple angles. The state is working to prevent people from becoming addicted by educating medical providers and through important work like our prescription drug monitoring program. We're making sure we are expanding access to treatment for opioid use disorder because we know that evidence-based treatments work. We're expanding our syringe exchange programs across the state so we can prevent unnecessary spread of diseases like hepatitis C and HIV. And we're working to make sure that the life-saving opioid reversal medication naloxone gets into the hands of those who are most likely to save a life. The work of Attorney General Dana Nessel is so critical to our state's response. Not only do we have to ensure that those who contributed to the crisis are held accountable, but we also need to make sure we bring desperately needed resources into the state to fight this epidemic. I look forward to continuing to work with the Attorney General and Governor Whitmer as we fight this crisis. Madam Attorney General, I'll turn it back over to you.
Thank you so much, Doctor. So these are sobering statistics for sure, and it's precisely why earlier this morning the state of Michigan filed a lawsuit in the Wayne County Circuit Court against 4 corporations alleging that they deliberately contributed to Michigan's opioid epidemic. And I've learned since then that this case has been drawn to the Honorable Patricia Fassard. So we argue that as distributors of controlled substances, these companies, Cardinal Health Incorporated, McKesson Corporation, AmerisourceBergen Drug Corporation, and Walgreen Company, had an obligation, a responsibility, and a legal requirement to ensure that those drugs would not get into the wrong hands. They also had an obligation to protect the Michigan communities these companies supposedly serve. They failed miserably. We contend that they failed to maintain effective controls and instead distributed and sold far greater quantities of prescription opioids than they knew could possibly be necessary for legitimate medical uses. They failed to report and take steps to halt suspicious orders when they were identified, and as a result of their individual and collective conduct, our state has experienced both a flood of prescription opioids available for illicit use and sale, and a population of patients physically and psychologically dependent upon them. Cardinal Health, McKesson, AmerisourceBergen, and Walgreens all used their licenses to distribute controlled substances in Michigan as a cover for what is essentially a criminal enterprise. They knowingly and deliberately distributed drugs in our state without controls. This was not only negligent, it was unlawful, a public nuisance, and as a result, subjects these companies to liability under the Drug Dealer Liability Act. These companies had all the tools available to identify and report suspicious prescribing and dispensing, and yet they showed a blatant disregard for their regulatory obligations. And in fact, despite multi-million-dollar settlements with the Drug Enforcement Agency, they continued to show a history of defiance, violating the terms of their settlement agreements with the federal government over and over and over again. And as a result, from 2006 through 2012, in just 7 years, more than 2,852,578,277 opioid pills were dispensed in Michigan. I'm going to say that again. 2,852,578,277 pills. That's more than 1.1 million pills coming into our state each and every day. Of those, more than 500 million were distributed by McKesson, and Walgreens wasn't far behind. The amount of opioids that were sent to Michigan far exceeded what could ever be consumed for medically legitimate purposes, and these companies knew that. In fact, thousands of shipments of drugs were of a quantity or frequency that exceeded or deviated substantially from normal patterns. These companies' failure to monitor, investigate, report, and halt suspicious orders of prescription opioids are a direct and proximate cause of the widespread diversion of prescription opioids for non-medical uses in Michigan, substantially contributing to the opioid epidemic and prescription opioid abuse, addiction, and death in the state of Michigan. These companies have demonstrated both malice and aggravated and egregious fraud. They were repeatedly admonished and even fined by regulatory authorities to the tune of hundreds of millions of dollars, but despite that, they continued to disregard their obligations to control the supply chain of dangerous opioids and to institute controls to prevent diversion. In fact, just for some examples, with the McKesson Corporation, they entered into an agreement with the DEA, agreeing to pay $150 million for failing to identify and report suspicious orders at several of its facilities. McKesson even acknowledged that its size and infiltration into various aspects of the pharmaceutical industry also provide the company with a unique national perspective on the diversion of controlled substances, including opioids. The company even conceded that it is partially responsible for the societal costs of the opioid epidemic this country now faces. Now, despite that agreement, McKesson actually developed a policy of not reporting suspicious orders. Cardinal Health, they agreed to pay the United States $44 million to settle the allegations of failing to report suspicious orders of controlled substances, including oxycodone, to the DEA. And in fact, it was Cardinal's policy to ship orders it knew were suspicious without conducting any due diligence or investigation. And in just a single month, in 2009, Cardinal shipped more than 146 million doses of fentanyl, hydromorphone, methadone, morphine, oxycodone, and oxymorphone across the country. And there is no doubt that millions of those doses landed right here in Michigan. AmerisourceBergen's breach of duties have persisted for many years, dating back to 2007 when the DEA shut down its Orlando, Florida distribution center as part of a DEA enforcement action. The company distributed hydrocodone to pharmacies in amounts that far exceeded what an average pharmacy orders to meet legitimate needs. And despite repeated efforts, a $36 million fine was levied by the West Virginia Attorney General and promises to design and operate an adequate system to identify suspicious orders. The company continually proceeded to fail to identify and then grossly underreported suspicious orders. Walgreens, they have a unique perspective. Because they are both a distributor and a dispenser, the company has access to complete information regarding red flags across its pharmacies in and around Michigan. But Walgreens failed to use that information to prevent diversion. Walgreens agreed to pay $80 million to resolve the DEA's administrative actions against the company. Now, it is this blatant disregard for regulatory obligations that has created an epidemic of fatal proportions. Specifically, these companies, 1, distributed and sold opioids in ways that facilitated and encouraged their flow into the illegal secondary market. 2, distributed and sold opioids without maintaining effective controls against the diversion of opioids. 3, chose not to effectively monitor suspicious orders. 4, chose not to investigate suspicious orders. 5, chose not to report suspicious orders. 6, chose not to stop or suspend shipments of those suspicious orders. And 7, distributed and sold opioids prescribed by pill mills when those companies knew or should have known the opioids were being prescribed by said pill mills. And because these companies knowingly participated in the illegal distribution of the prescription opioids purchased by Michigan residents, these companies are therefore liable to the state of Michigan under the Drug Dealer Liability Act for damages caused by opioids acquired from their distribution channels. And those damages include, but are not limited to, the costs that have been or will be borne by our state for the following: increased law enforcement costs, healthcare costs, costs to care for housing, rehabilitate and foster opioid addicts and opioid-dependent infants and the children, costs associated with early childhood intervention, special needs education costs with respect to infants born with neonatal abstinence syndrome because of opioid abuse and who require special education when they attend local schools, prosecution-related costs, including the hiring of additional prosecutors, investigators, and staff, as well as additional courtroom-related expenses, costs for additional jail space, and other costs associated with incarceration, drug treatment program costs, and also any other financial losses proximately caused by illegal drug use. Meanwhile, the opioid epidemic continues to rage unabated here in Michigan, and that epidemic continues to be fed by these companies precisely because the fines and suspensions imposed by the DEA did not change the conduct of this industry. McKesson, Cardinal, AmerisourceBergen, and Walgreens all paid fines as a cost of doing business in an industry that generates billions and billions of dollars in annual revenue. So, in conclusion, let me say this. I saw the governor all the time on the campaign trail back in 2018, and I don't think you or I gave a single speech where we didn't talk about the need for us to address this epidemic head on when we got into office. And I know that today we are fulfilling our commitment to do just that. And there have been obviously many other things that you've done as well that I know the public should appreciate. But we promised this to everybody. We promised that the state of Michigan would no longer sit idly on the sidelines while companies profited from an addiction that they helped create, and an addiction that has claimed loved ones from our families and has devastated our communities. And that's why today will not simply be known as the day Michigan decided to file this lawsuit. Instead, it should be known as the day that Michigan began to fight back. So thanks very much for everybody for coming today. I don't know if Governor or Doctor, if you want to join me up here, and we're happy to take questions. Well, we don't have a specific amount other than to say over $75,000 as required by the court rule. I can assure you it will be well in excess of $75,000. There are a lot of numbers that have been tossed around, and we'll tell you that I've been involved in some settlement negotiations that involve some of these companies. My hope is that when all is said and done, when you look at everything, including abatement, when you look at potentially certain types of products that we're going to ask be offered by some companies, I'm hoping that it'll be north of $1 billion when all is said and done.
Just to be clear, all of that money would go into the things you mentioned as far as spin-off costs from the effects of these opioids?
We hope that that's where the majority of it will go. Certainly that's the intention. And let me say this. When you look at the way that the tobacco settlements were structured, there's an enormous amount of money. And, prior to this, the biggest settlement of its kind, not just in the state, but nationally. And I think one of the big concerns that people had with that money and the way it was utilized, one of the big concerns that we have here in the AG's office is we want to make sure that the money that comes in from any projected settlement or judgment is actually used specifically to target the opioid epidemic and to allow for treatment for individuals that need it, and a variety of other things that are needed, whether it be diversionary drug courts, drug rehabilitation, products that can be used in the event of an overdose, and so on. We want to make sure that that is where the money actually goes, as opposed to just, for instance, going into the state treasury and then being used for other things that have nothing to do with the opioid epidemic. So, for us, I know that that's the goal. We want it to be used to actually address this problem. I don't know if you guys have any comments on that.
I think that's
Okay.
Madam Attorney General, have you heard about the pharmaceutical company who's mostly responsible for this crisis in the first place, now offering an antidote for overdoses?
Is that Purdue that you're talking about?
Yes.
Okay. Yeah, that's not actually, I know that broke recently, but we had heard about that for a long time. I mean, what can you say? What can you say about a company that creates this crisis and then conveniently also profits off the antidote to an overdose? I don't have a lot of positive things to say about Purdue. I don't have a lot of positive things to say about the Sackler family. I will say that our department has been involved in negotiations involving a settlement with them, but I can tell you this, from all appearances, they've been less than transparent and less than honest about what the true nature of their assets are. I know now that they've filed for bankruptcy, so it creates a few issues in terms of new litigation. But, this is the first of any cases that we're filing on behalf of the state of Michigan. I can tell you this, I doubt that it's going to be the last. These four companies it's very unlikely that they're the only four companies that we're going to be pursuing.
What sort of impact do you think winning this potentially would have on the statistics we heard when you started, increasing deaths and increasing costs?
Oh, I think personally it's going to go a very long way towards that. And when you look at all the different types of programming or emergency services or products, I mean, these things are, incredibly expensive to the state. And our state is paying, our municipalities are paying. And there are a lot of times, I'll tell you this, I was at a Prosecuting Attorneys Association annual conference over the summer, and I heard a couple of our county prosecutors that were really just sort of beside themselves because they really wanted to have drug diversion courts specifically for opioids in their courthouses, and they just simply couldn't afford it. And I heard one particular county prosecutor in the west side of the state just lamenting the fact that, they had estimated to only be a couple $100,000 for such a program, and we know how effective those programs could be. He just couldn't afford it. And he was unable to motivate the legislature to provide the money that he needed for it. And that's the kind of thing that we need. We need to make these drug distributors pay for those sorts of programs, which we know are effective and we know for a fact save lives. You guys want to? Every time, just chime in if you want to talk.
No, it's nice not to be the one they're directing questions.
Great. When I get to a hard one, I'm just going to punt it to her. So, yeah. Oh, great.
I don't know that I've got a great, thoughtful response for you in this moment, but I certainly would be happy to get back with you. I've not had the opportunity to study them, although I'm sure my staff has, and love to give you a more thoughtful response.
What's the difference between suing these drug companies and not suing the auto companies producing cars that kill people?
I'm going to defer to my lawyer on that one.
Yeah, I mean, when you say cars that kill people, those are accidents. First of all, those aren't situations where you knowingly have a company that is illegally, that is contributing to the illegal diversion of pills that are going to cause addiction and later death. I don't see those things as the same at all whatsoever, actually. And I certainly don't think whether you have Ford or Chrysler or GM, I don't see them distributing their product knowing that those cars later will be used to kill people, even though in accidents that happens all the time. I don't see the analogy.
We're targeting these 4 companies, and we're talking about them today, but how much of the responsibility is also on the doctors?
Well, there certainly are those pill mills where there are doctors that were overprescribing, and when we find that, we go after them. I mean, that is something that we do. But when you're talking about the scale of this epidemic, the fact of the matter is these companies had the ability to monitor those pill mills. They knew that those pill mills were operating, and they kept shipping these products out irrespective. And so, yeah, we're going to continue to prosecute those doctors when we see that happens. But when you talk about the real heart of the problem and you talk about how this could have been honestly easily prevented, you really have to look at these companies instead of looking at individual doctors. And I know this will be a different topic when we talk about the manufacturers, but I mean, even the way that these products were marketed to the doctors. Quite honestly, there were a lot of doctors out there that thought they were doing the right thing when they were prescribing these products. And why? Because they were sort of trained by those companies that these medications, would be non-addictive and you could prescribe as many pills as you wanted and everybody would be just fine. And they knew that wasn't true. But they went ahead and they made those guarantees to those doctors irrespective. So while there are doctors out there that I believe have acted in a manner that's not commensurate with their professional licenses, I think there are a lot of doctors out there that also got duped.
Why is Michigan one of the last states to bring suit against?
I'm happy to answer that question.
I figured she would be.
So, as you know, I've been in office for almost a year now. Someone else was in office the 8 years prior to that when a lot of states were filing these lawsuits. And in terms of what we've done during the course of this year, this is a time-consuming process. So, as soon as I got into office, we started having those discussions, and I'm looking at some of my division chiefs right here who were so instrumental in making this happen and working diligently with me day in and day out on this. But we started right away when I took office. But, I wanted to make sure that we had a process that was transparent and that was fair and that was diligent in terms of seeking out outside counsel that we knew had the best expertise when it came to these types of lawsuits. And so we went through that process. It was a blind process. It's available, by the way, to anybody. And we're happy to provide that to you so you can actually see the request for proposals and then all the proposals that actually came into us. So it took us some time to go through that. And then we had that approved by the state admin board unanimously, actually. And then as soon as we selected them, we went about the process of negotiating what we thought was the very best contract for the state, where the state would receive the most money out of any potential settlement or judgment. And then we started working with them to draft a complaint. And it's, I think, a 300-page complaint, which you don't draft overnight. And this one is a little bit novel. It's a little different than previous lawsuits that have been filed in other states. And so that's what we spent the year doing. What my predecessor spent the 8 years before that doing, you'd have to ask him. But one thing I know is he didn't do a damn thing when it came to moving forward on these opioid lawsuits, which I believe are critical in regard to getting the finances that we need and that our state deserves to tackle this incredibly devastating epidemic.
I'll just say one last thing. This is a historic day, all right? The Attorney General's lawsuit has, we're going after peddlers who are under a drug dealing cause of action. I think that this is something that's historic. It's also historic that we're standing here together, aligned with the Department of Health and Human Services. That's something that hasn't happened in Michigan in quite a while, and I think that this is worth noting as well. So thank you for your leadership, and thank you all for covering it.
Thanks, everybody.
Thanks.
All right.